every health facility and the kind of equipment they need. So you cannot go and put an anesthesia machine at the CHEP compound. It is useless. And so government has taken the decision to retool our health facilities, number one. This is just the beginning. We have 50 anesthesia machines. Kolebu, because of the enormity of work they do, we are giving them 8 out of the 50. This is the first tranche, and we'll make sure that what we have for now will be evenly distributed per the needs of the facilities we have in this country. And we've also requested that they take very good care of it. Government is not going to do the retooling alone. We are going to include the private sector. PPP is part of the retooling. Now we are working on dialysis machines. From there, we'll go to the next point. So the private sector will be our partners to make sure that every health facility in this country has a required um, number of machines or personnel to be able to execute their work very, very, very well. And I made mention of the posting of our medical doctors. It is true that about half of the medical doctors we have in this country are in Accra, and to be specific, Greater Accra. And obviously, everybody would understand that it doesn't, it is not equitable when it comes to the distribution. And so there's the need for us to reset that particular distribution. And so we have the opportunity to distribute more than 700 medical doctors, and we think that about 80% of them should go to the districts. And of course, we have to put certain measures in place to be able to encourage and incentivize those who accept postings to those areas. And one of them will be the number of years you spend at a district to get the opportunity to come and do your fellowship, right? Your specialty. And so if it is, for example, if you must serve in Accra for 4 years before you are given the opportunity to do your specialty or to become a specialist, maybe if you spend 2 years in the district, you should be able to get that opportunity to come and do so. So there are some incentives package we are putting together to encourage our wonderful medical doctors to give off their. So he raised the point that there are some critical needs, and so you see there is a presidential directive that people who have attained the age of 60, they are, we should not renew their contract so that it will give way for the young ones to also fill those gaps. But of course, to every law, there is an exception. If we have a critical need, we can make a case and then we'll look at it.